Hello, patient H. Welcome to the third assessment within the prescribed 6-month period. 4 assessments to begin therapy. You've met Dr. Nebo Gipfel, I think, on other occasions. And I'm Dr. Betelgeuse, who I also think you have met. Haven't you?
Well, let's get down to it. We've decided that we can't really decide whether you're suitable for therapy or not, and whether there is really therapy here for you. Firstly, you've come from the complicated needs service, where we hear you did very badly indeed.
Yeah.
In fact, they threw you out without an explanation.
Yeah.
And
that counts against you in some senses, I think.
We understand that you haven't really taken responsibility for that. So I think that probably means you're unsuitable.
Well, I think you're too ill for therapy.
There is the illness. I mean,
that's an issue, I think, isn't it, Doctor?
That is a very big issue. You can't
yes,
come here just
I think it
ill.
is. I mean, our patients are, generally speaking, in the therapy group, they're half ill, and half well. 50% ill, 50%. Some of them are 90% ill, and 10% well.
Some of them have a 90%. We should mention some of them have a 90% chance of deteriorating.
Yes.
During therapy, I say to some of them, you've only got a 10% chance of getting better. There's a 90% chance we're going to damage you.
Yes.
Those are the suicidal patients.
But we don't accept responsibility for that, of course. It's your responsibility when you enter the therapy to understand those figures, which have been scientifically worked out on a sliding scale of between 50 and 90%.
It's a sliding scale from 40 to 70%.
Yes.
And in fact, we are just making those figures up, aren't we?
Well, you could say that, yes.
So let's just unpack how you're too ill for therapy, since you're asking in a rather aggressive and angry manner.